Hi, my name is Jordan Harding, and I'm going to be showing you the manual muscle test for the glute medius muscle. First, we're going to want our patient lying on their side. We want them to be comfortable so they can support their head with their arm, as Kelly is doing right now. As far as position for the test, we're going to have her laying side lying with her lower leg bent, just to provide some stability for her. Make sure she's not rotated forward or rotated back, so just in that neutral position. We're going to want to make sure as well that the foot and the rest of the leg is in that neutral position. And then we need to remember to ask our clients to contract and maintain a straight knee. So go ahead and contract this quad here, Kelly. There we go. And then we'll cradle the leg just around the knee. Bring back in just a little bit of a hip extension. And then we're going to bring her up to about 20 degrees of hip abduction. And some things that we could see compensation-wise is if Kelly were to externally rotate her leg during the test, that could imply the piriformis kicking in. If she were to internally rotate and flex, that could imply that the TFL and the hip flexors kicking in. Or if we see a hip hike as she's going through the test, that could be indicative of the quadratus lumborum kicking in to provide a little bit of synergistic dominance and compensation. So let's go ahead and again get in that position. So foot straight, contract your quad, and we're going to bring you up into 20 degrees of abduction. So hold this position there. And our force is going to be applied at the knee, adducting the leg. So go ahead and hold this position, push, 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 push. So I'm going to grade her a grade 2 there. She wanted to go into hip flexion. So what we'll do is we'll back off and go to a mid-range. Let's go about right there, kind of midline, almost to that midline there in the hip. So we'll again contract your quad, Kelly, contract, contract. There you go. Hold this position and push up, push, 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 push. All right, and that was much better. So bringing her back in that mid-range had the strength return. So we know that we need to go and that'll give us an idea where we need to go do our treatment. Let's go ahead and test the other side. So kind of roll over to your left side. Good, and then just, yep. Let's go ahead and bend this left leg. There you go. And contract your quad. Foot in neutral position, contract here. Again, 20 degrees of abduction, so hold this position there. And don't let me push you down. Hold, 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 hold. Again, I could feel her wanting to go into hip flexion. I also felt a little bit of her QL kicking in. So let's bring her back down to a little bit of mid-range. So contract your quad here. And hold right there. And push, 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 push. And her strength returns. So similar to the other side, this side I would say that I felt a little bit more of the QL kicking in. So again, we'll tailor the treatment to what we noticed as far as compensations. And that is the manual muscle test for the gluteus medius.